when you hear the words mental illness? Usually when people think of mental illness, they look at the big ones such as bipolar disorder, schizophrenia, multiple personality disorder, obsessive compulsive disorder, eating disorders, and major depression. Most of us know that these mental illnesses have a stigma attached to them. Crazy. Of course, this is entirely untrue. You may be thinking to yourself, you've never thought that way, but really think about it for a second. Even if you don't perceive people suffering with mental illness as crazy, there are definitely people out there that do. Now, as much as I would like to talk about all of the major mental health issues in our society, I want to focus on two that sometimes fly under the radar because people live with them every day. These two can be starting points that could lead into some of our major mental health issues, but this is why it's important to know that the two that I will be talking about today exist. I can almost guarantee you that you know someone that has suffered one or both of these minor and very treatable issues, and that's minor depression and anxiety. Today, I want to enlighten you on some of the facts behind these two disorders and encourage you to break the stigma and talk about them. Talk about them with your friends, get people talking about it because these mental health issues have an 80 to 90% recovery rate. But we just have to let people know that they're not crazy and it's okay to get help. Let's start with depression. Depression may be better known of the two because we often see it as the culprit to suicide. Not everyone dealing with depression is suicidal, but if small depression is left untreated, it can certainly lead to that. Depression could lead loss into everyday hobbies, changes in appetite, sleeping too much or too little, pessimistic thoughts, low energy. Um, Depression is typically longer lasting than if someone is grieving over a loved one or getting over a breakup. But the fancy term to this minor depression that I've been talking about is dysthymia. Now let's talk about anxiety. Anxiety fits in with depression, but it is even less talked about than dysthymia. And I'm mainly talking about general anxiety disorder. People with generalized anxiety disorder experience constant chronic worry about their health, their family, their work, their financial situation, and the worrying goes on every day. It's something that just people are always over analyzing every situation, every aspect of everything, and pretty much expecting the worst out. And some of the side effects of this could be muscle tension, fatigue, restlessness, difficulty sleeping, irritability, and edginess. Obviously, you can see from the two that these are both very similar, depression and anxiety. So what I'm going to show you right now is a little picture of a figure to kind of show you what it looks like mirrored up against each other. You can see that depression has the bigger bubble, but within that is anxiety. I'm going to talk to you guys about some statistics about uh, depression and anxiety, but I'm going to start with anxiety because actually, ironically, mental disorder that actually is the kind of the least talked about is the most common mental illness in the United States. It affects 40 million adults in the United States ages 18 or older, which is 18% of the US population. Anxiety disorders are highly treatable, yet only 1/3 of those suffering receive treatment. People with an anxiety disorder are 3 to 5 times more likely to go to a doctor and 6 times more likely to be hospitalized for psychiatric disorders than those who do not suffer from anxiety disorders. 25% of women are said to suffer with depression, along with 15% of men at some point in their lives. I think that first and foremost, one thing to know is that it is okay to see a therapist. People think of a shrink and immediately go to someone sitting on a couch, just letting your stream of conscious go, or maybe looking at some ink blots. That's entirely not true. How do I know this? Because I've been to a therapist. Going to therapy is more like talking to someone that's outside of your world, and I think that the people that are suffering from dysthymia and anxiety need to know that. Um, People need to know it's not weird to go to therapy, and ignoring the proper help can worsen things in the future. Sometimes you just need to be completely removed from your life to declutter your mind and see something from a new perspective outside of your own world. And therapists do that for you. So, how can we get more people talking about this? Well, hopefully, after this talk, you can understand that, people that are sitting there right next to you in class could be someone that's suffering from anxiety or depression. And you can look at the signs and the statistics and really just start talking about it. I mean, to let people know it's okay. If you have a friend that you know that might be suffering from one or both of these issues, let them be open to you. Let them know that you're there to talk to if they need anything. And then maybe once you get talking about it, you can suggest a better way for them to handle it by referring to them someone outside of the situation, because I think it's more, people need to look at therapy from that way, that people need to see it from outside the box, not from inside. Like, it's not like, oh, you have a problem, you're going to therapy. It's, oh, like, I have things that I'm not really sure that I want to deal with or know how to deal with, and maybe I should talk to someone that's outside of this. And that can really save a lot of people. So I think that our best modes at this point are to really just talk and make it as normal as possible in everyday conversation.